Hey everybody, Dr. David Thomas here, physical therapist at Cadence Physical Therapy. Today I'm going to be talking to you guys about the 4 stages of recovery, the 4 stages that need to happen in order to have a successful rehabilitation and outcome from physical therapy, at least in the outpatient setting. So really quickly, I'll cover over the 4 stages and then I'll get into more depth of what they are. So first stage is to address minimizing the pain and inflammation. Second stage is addressing strength, mobility, and flexibility deficits. Third stage, returning to normal function and activity level. And then finally, one of the most important stages is the maintenance and prevention of injury. Patients come to outpatient physical therapy typically for one of 2 reasons. Either they're experiencing pain or there's a loss of function. Most of the time, both are coexisting together, but for most cases, pain tends to be one of the more prominent issues that patients will seek out rehabilitation because the pain becomes intolerable and then ultimately limits their ability to be functional. It's important that every patient experiences and completes all 4 stages. So first, let's go through each stage a little bit more in depth. Okay. So stage 1, minimizing pain and inflammation. So we're going to work on activities to reduce experienced pain, reduce the inflammation so that patients can go back to work, patients can return to their normal activities of daily living, whether that's caring for their grandchildren, being able to sit long enough to be productive at work, being able to squat low enough so that they can do construction, numerous activities depending on their expected ADLs or activities of daily living. So reducing the pain and inflammation to at least tolerable levels so that therapy can be completed and that they can perform expected activities outside of physical therapy. So once we hopefully eliminate that pain or at least reduce it to more tolerable levels, we're going to start focusing on improving your strength, your mobility, and flexibility. So this is going to address the impairments that may have existed prior to the injury or that the injury may have caused so that posture can be restored, flexibility is not limited, and then strengthening the areas that are weak that may have contributed to the cause of this injury. So once we combine both those stages, we'll still be working on activities to continue to reduce and maintain pain to low levels or eliminated levels. But we're incorporating that phase 2, so getting you stronger, more flexible, more mobility. Once goals have been achieved in that second stage, we're going to progress into the third stage, which will continue to incorporate all 3 stages. But now we're introducing that third phase, which is returning to normal function and activity levels. So we're going to be returning to those activities that may have either caused the injury, activities or movements that may contribute to pain initially on, so that we can fix those faulty body mechanics and get you back to doing the things that you need to do, whether that's the sports, activities in school, work-related activities, or caring for grandkids, etc. Depends on the goal of the patient, right? Finally, the most important stage of physical therapy is the maintenance and prevention of injury or re-injury. So the biggest issue with physical therapy is most patients become fixated on that stage 1, which is just minimizing pain and inflammation. And a lot of patients will feel, oh, now that my pain's gone down to more tolerable levels, I don't feel as much pain anymore, I'm done with therapy, right? Absolutely not. Finally, the most important stage, patients that we've seen that did want to cease physical therapy because the pain was abolished or the pain was reduced to tolerable levels and they didn't complete the 2nd, 3rd, and 4th phase of therapy. 9 times out of 10, the patient comes back 1, 2, 3, even 4 months later to continue to redo physical therapy for the same issue. And then once we begin to address those other stages that they didn't, want to complete prior, the patients will experience much longer term gains in function and longer term reductions in pain. So we want to make sure that we complete all 4 stages, again, minimizing pain and inflammation, improving strength, mobility, and flexibility, returning to normal function and activity levels, and then finally that and most important crucial stage, maintaining and preventing injury and future re-injury. So with completion of those 4 stages, every patient that we've had at Cadence Physical Therapy that's completed all 4 stages appropriately have seen longer outcomes in regards to pain levels. They didn't have to come back for physical therapy longer. They had better improvements in their outcome measures that are objectively measured. And finally, the patients had a greater experience with physical therapy in general, and then became believers that exercise is actually healing. So hopefully that helped. If you guys have any questions, please feel free to reach out to my email at davidthomas@cadence-pt.com. Thanks, guys, and take care. Bye-bye.